Hello, thanks for joining me today. Recent studies have concluded that HIV/AIDS patients are having a hard time getting the health care that they need. Why, you ask? Well, you may be shocked to find out that it's because of stigmatizing stereotypes carried by society and especially by healthcare professionals. You would think that those in the healthcare field would understand the effects that HIV/AIDS has on people who are afflicted with the virus, but it has become astonishingly clear that many remain ignorant and let their fears guide their behaviors. By the end of my speech, you will be aware of what the stigmas are that patients with HIV face, why society discriminates against HIV-positive people, and some things that can be done about it. Stigma is defined as a mark of disgrace associated with a particular circumstance, characteristic, or person. UNAIDS, or UNAIDS, a United Nations-based company, defines HIV-related stigma and discrimination as a process of devaluation of people either living with or associated with HIV/AIDS. Discrimination follows stigma and is the unfair and unjust treatment of an individual based on his or her real or perceived HIV status. Even though more information has become available about the cause, prevention, treatment, and effects of HIV/AIDS, societal concepts reveal that there is a stigma surrounding the ailment. Patients of HIV/AIDS suffer from hurtful stereotypes, mostly stemming from misunderstanding of how the virus is transmitted and what kind of person contracts it. According to an article from the Journal of the International AIDS Society entitled Combating HIV Stigma in Healthcare Settings, What Works, from August 6, 2009, research shows that stigma and discrimination in healthcare settings elsewhere keeps people from assessing HIV prevention, care, and treatment. They cite three major causes for HIV-related stigma: lack of awareness about what stigma looks like and why it's damaging; 2, fear of casual acquisition due to lack of knowledge on how HIV is transmitted, and also the associations HIV has with immoral behaviors. These factors often cause people to avoid being tested, to seek care for fear of being identified with AIDS. Sometimes they seek care too late, where the virus has progressed beyond optimal medicinal help. In an article from the American Medical Association Journal of Ethics from December 2009 by BBJ Anderson, JD, stigma and discrimination towards HIV patients still exist, even though there are compulsory legal protections in place. Some ways that those living with HIV are discriminated against are denial of or loss of job, loss of residences, court-ordered limited contact with family, and most unfortunately, denied proper and timely treatment by healthcare workers. Some who have been discriminated against at healthcare facilities have pursued lawsuits for violation of anti-discriminatory laws. Healthcare professionals have an ethical duty and should take into account the effects on patients and avoid stigmatizing behavior. The stigma of having HIV and being discriminated against has a profound psychological impact on patients. Healthcare workers should be aware and act accordingly. Now that we've gone over some of the most common reasons for HIV/AIDS stigma, let's talk about some solutions. Training, supplies and equipment, policies within healthcare facilities, and enhanced public knowledge are some solutions to the problem. The Journal of the International AIDS Society entitled Combating AIDS Stigma in Healthcare Settings, What Works, from August 6, 2009 suggests that increased awareness of healthcare workers of what stigma is and its effect on patients, and complete information about the virus and how it is and isn't transmitted would help reduce the stigma and discrimination of HIV patients. Basic supplies, equipment, and information for precautions and preventative measures such as gloves and biohazardous containers would also help reduce discrimination. And also, hospitals and healthcare facilities need to put policies and clear guidelines into place that healthcare workers should follow. and a study by scientists from UCLA and Columbia Universities on stigma in the HIV/AIDS epidemic, a review of the literature and the recommendations for the way forward from August 2008 suggests that promoting reform laws and policies and mass media campaigns to inform the public with correct HIV/AIDS information and ways to reduce the stigma are viable solutions to HIV stigma discrimination. So let's review. HIV/AIDS